Welcome friends, this is Dr. Jaitly on your favorite video site MuniMeterHealth, which is on several social platforms showing in the form of video vignettes, primarily engaging in promoting the education both for medical fraternity as well as for patients at large. Medical education, patient education, both have been shown to improve the clinical outcomes across the board, and that has been my deepest global initiative. So welcome again on MuniMeterHealth. Today we're going to be talking about what are the effects of exercise on cholesterol. Are there any effects at all? Yes. Well, first understand that there are coronaries which are supplying the heart. So these are your coronaries. Just so that you know, these are the vessels, arterial vessels, which are supplying the heart. Remember, the heart supplies the body, but the heart is being supplied by its own self, and that's the beauty about this organ. So it takes away a little portion of the blood before it sends it over to the rest of the body, right? Don't we all do? We always like to work for the world, but the fact is that we gotta have, you gotta stay yourself in shape. So the heart stays in good shape by the arterial oxygenation that's coming through these coronary vessels. So the left coronary is right here, and the right coronary is right here, and you can see the right coronary travels along the right heart border, this being the right heart border and this being the left heart border. The left coronary actually divides into two right very early on. This becomes your left circumflex, and this becomes your left anterior descending, we call it, and this is your RCA, which is the right coronary artery. So this one is your right coronary. Okay, so coronaries are very important, and obviously the plaques, if they were to develop, or the obstructions we call them, the atherosclerotic plaques, the fatty lipids or the fatty streaks that develop or as we all age, depending upon what food we eat and genetics and smoking and other habits, which we've talked about in different other videos. These plaques will go on to obstruct these coronaries, and the same thing happens in all the vessels. May it be the brain, may it be the kidneys, may it be the peripheries in your upper and lower extremities, etc., leading to hypertension, stroke, heart attack, or what have you. So it's very important that these plaques should not happen. And again, cholesterol is the culprit here, by the way, which is responsible for this. Now remember, cholesterol is one thing, but the second thing is triglycerides also. So what is the effect of exercise on cholesterol? The first thing, what we know, there is a good cholesterol called HDL. H for healthy. Remember, this is healthy. Now remember, we have a healthy cholesterol also, right? So healthy cholesterol starts rising when you exercise. Now it has to be 30 minutes 3 times a week. That's the recommendation, to see the HDL bump at least 10 to 15 points up. Remember, milligrams per cent, we call it milligrams per deciliter of the blood. That's where the HDL is measured. Triglycerides. Now triglycerides are also another component of fat which is present within the bloodstream, and they're also responsible to a degree to form these plaques. Triglycerides start going down. And LDL, which is the lousy cholesterol, I call it, the lousy cholesterol. HDL is the good cholesterol. So lousy cholesterol, that drops very minimally, or very small amount, so or hardly changes. So LDL is not affected by the exercise as much as HDL and triglycerides are, where HDL goes up and up, and triglycerides goes down and down. So both these effects are very important. In fact, of course, in general, you would say that the LDL HDL ratio, which also a lot of labs report, or even doctors and cardiologists are interested in knowing that. So this ratio improves. Why? Because HDL is getting up. So your risk factors in general for cardiovascular risk, I call them, they actually get better. So because they get better, the chances of your plaque formation, which I've shown in this artery, these are all your plaques here. Now that's the magnification of this thing right here itself, and the plaques are here, which are consisting of oxidized LDL, we call it. They are consistent of fibrin and platelets and macrophages and foam cells. Again, not to confuse you with all these terms, but just so that you know, effect of exercise on cholesterol is clearly on HDL and triglycerides. LDL is very minimally affected, the lousy cholesterol, but the healthy cholesterol definitely improves, but only to about 10 or 15 points. If you have to improve more, then you have to use other measures, which we'll discuss on some other video. Okay, so here, this was a very short video, primarily geared to tell you that there is an effect of exercise on cholesterol. And again, it's not like one time a deal that you do it on the weekends and that's it. You have to do it consistently, as I said, 3 to 5 times a week, preferably 30 minutes in a, whatever form that you want to exercise, preferably aerobic exercise like walking, running, biking, swimming, and of course playing tennis or anything else that you can get involved with in terms of outdoor activity. So that'll help a great deal. Okay, so thank you again for watching, and stay well and stay with MuniMeterHealth, your favorite video site on several social platforms. This is Dr. Jaitly. So long, and see you again on our next